understanding the nervous system, understanding what I do here, and how we go about things a little bit differently, okay? Because many of you, like we just talked, you've tried the therapies, you've tried the counseling, you've tried the nutrition, you've tried all of these things, but many people here tonight obviously know, and most of you are, sorry, there's, how many got 2 guys here? Yeah, 2? Mama gut. Sorry, you guys don't have it. but that mom intuition, that female intuition, like we've always just known, like these things are helping, but I still feel like something's missing. Like, what is it? Like, how many of you have probably felt that? Yeah, for sure. Okay, so you're going to kind of get that answer here a little bit tonight, how that kind of can tie in. Not that any, and I do not bash one profession, one anything, because it's all so needed. Because to teach a kid behavior, sorry, I'm not a parent either. I've dealt with a lot of kids, but I'm not going to tell a parent one thing on how to, train behavior or what's right nutrition or do we eat gluten. Gluten shows up to a party all of a sudden, people are like, oh great, gluten's here. We all get it. Be boring. So those things though were around. They've been around. We've had diet. We'll get into this. We've had the diets. We've had the chemicals. We've had this. Why so much here lately, recently, and it's kind of skyrocketed, I feel, the past 20 years. Would anybody else agree? Okay, so getting started here, my why and then what's at stake. I know why all of you guys are here. You want to learn. You've felt some frustration, you've felt some hurt, you've felt maybe anxiety yourself. My why and why I'm here. So I was a gymnast, did a double back, didn't quite make it all the way around, was in a lot of pain. Mom and dad were very medically minded. Okay, so we went to the doctor, we went to a surgeon, we went to a neuro, we went to all these different people to figure out this neck injury that I was having, because it turned into, I was only 12 years old at the time, excruciating pain, headaches, anxiety actually started to kick in then. Never really had it that bad, but I started to get it terrible. So did all of this, come to find out, one of my teammates that was a couple levels ahead of we weren't, hello, do you need a chair? I wish I could go like, poof, there's a chair. At least we'll grab it. So go to all these different doctors and whatnot, and lo and behold, one of my teammates was a few levels ahead of we didn't have the same times that we worked out together. Her dad was a chiropractor, and they go, you know what, you should go to doc. And I was like, of course, skeptic. Who's a skeptic? Sometimes with chiropractic, there's a lot of us out there. Mom and dad are like, okay, sure, here we go. So we go in there. Dad's completely traumatized already. He's like, this person's going to do what to my child, how, whatever. He sees all this happen, but I tell you what, within about a month, my pain was gone, headaches were gone, anxiety had gone down. So many things had changed for me, and there I was at this 12-year-old, probably 13 at that time, because it took some time for us to get there. Life completely changed, and from that moment on, I'm like, this is what I'm doing for a profession. This is what I'm going into. It's a doctor that people like to go to. They actually get better, and every person that I saw there was happy. So I thought, cool, okay. Fast forward, I go to chiropractic school. I am my first year in. I'm thinking neck pain, back pain, headaches. I'm like, I'm going to cure everybody of that. And I get into a neurology class that explains how the nervous system actually works. And I go, holy crap, this is way more than I ever imagined. Fast forward again, through school, starting to work, taking care of back pain, neck pain, headache patients. Go through a pretty life-altering experience about 4 years ago myself. Anxiety set and crept back in immensely again. I'm talking debilitating. I have never once experienced anything like this. For about 2 years, I had it. And the effect that it had on me, the effect that it had on my practice, on where I was, my marriage, everything, just took a toll on everything. I was desperate. I looked for every single answer I could find. I changed my diet. I went keto, I went paleo, I went to every therapist, I went to neurofeedback. Nothing was fixing it. And then one day I sat there, and I think it was by the grace of God, and he knocked after the nightless sleeps, which I'm sure many of you parents have of taking care of these children. I go, it's my God-forsaken nervous system cranked up on high. I can't sleep. I'm anxious. I'm getting depressed. I can't eat. My digestion's terrible. I've been sick way more. And I'm sitting there going, what in the hell am I doing? Sought out the technique that I do, started doing a lot of research, started doing a lot of understanding, started getting back into what I knew it was right with chiropractic and taking care of people's nervous systems. And that's when it all clicked for me. changed technique, changed the way I practice, started balancing the brain with the body with the brain. I started getting adjusted 3 times a week for 3 months, like I suggest a lot of my patients do, because we got to turn that nervous system down. Sorry, I talk fast, but I get passionate about it. But saw my life turn around in 3 months. That was 3 years ago in October of 2018. And since then I haven't looked back. I have slept through the night every single night. No more heart palpitations, no more anxiety, none of that. This takes me to the point of, I'm an adult. I know kind of what caused it. I know what I was feeling, that it was anxiety. I know all of these things, and my brain was hyperactive, everything. And guess what? These kids, most of these kids are experiencing this, but they don't know why. Does that make sense? As adults, we know if we have too much on our plate. We know if we're way too stressed. We know what we should do, but many times we keep trudging on. But what do we end up usually getting? Digestive issues, like heart palpitations, heart issues, immune issues. We're getting sick more often, okay? So that's what makes me so passionate now. I love adults, I really do, I'll take care of every single one of you. But those kids, what breaks my heart for them is they don't understand. They don't understand what's going on. So think about what behavior you have whenever you don't understand something and you're overwhelmed. How do you react? Okay, does that make sense? Okay, let's dive in. Starting off here, this little guy right here is John. And you can see this big, beautiful family right here. Whenever we talk about, yes, it's just this one little kid that was having issues with focus, attention, anxiety, stuff like that, but it impacted the entire family. It impacted that they couldn't go to the movies, they couldn't go anywhere without thinking, Lord Jesus, what is John gonna do, and what kind of outburst is he gonna have, okay? By the time mom and dad came rolling in here, you could cut the tension with a knife. They were angry at each other, they were tensed at each other, they were exhausted, they were just kind of at their wits' end. So talk about like, okay, it's gonna be okay, it's gonna be okay. But like he just had poor, inability, so I'm sorry, and I'll kind of help you guys in the back, inability to communicate clearly, wasn't sleeping at all. Can you imagine having one of 6 children not sleeping at night, what that's gonna do to a household? Yeah, that's not gonna be very good for anybody. Everybody was exhausted, the kids were getting frustrated, the kids were getting angry at their brother, because it's like, you're messing up literally everything, okay? This family then finds out what their nervous system is and how it functions and how it can actually be helped by just calming it back down. This family's life was completely changed just by changing one little thing in their child, okay? So sleeping better, listens and responds more effectively. It was actually dad and him would bump heads a lot. So it was kind of dad that took on the responsibility with him, bringing him to appointments, stuff like that. And their relationship's just thriving so much more. So like think about if that were to have continued on for years and years and years and years, how that would be with their relationship, how this marriage might have even handled up. So it's just a bigger picture than taking care of this child, yes, but it's actually a whole family cohesive unit that we want to look to more, okay? So actually that entire family, they saw the benefits. So like, you gotta check out sister now and check out the other 4 kids over here. So it's just that whole family cohesive unit that we want to work on. One of the take homes then with that there, stressed out kids, what does that do to parents? Stresses parents out. But then stressed out parents, what do the kids sense? You're stressed out. So it's like this, So we gotta find a way to break that mold. We gotta find a way to get a different path going, okay? Good. So tonight we're gonna be talking about what's going on, like what the heck, why, and some action steps and what's next. So what's going on? And I'm sorry, this is so small back there. I need to get a picture. Concentration. How many people here have kiddos with concentration issues? How frustrating is that to get homework done at night? How frustrating is it just like brush your dang teeth and go to bed, right? Coordination. I'm talking physically, but then also kind of verbally. Like they trip over their words. They can't get. They want to get, but their brain's going so fast that they can't calmly say it. Regulation, this is going to be regulation of emotions, tantrums, yep, exactly. Then also regulation of like their digestive issues. This is gonna be, you know, we're gonna have kiddos with issues like constipation a lot, like they're just really bound up in there, as well as when to eat, when to sleep, and when to go to the bathroom. How many of you have had a kid that they're just standing there and all of a sudden just like, it's like, you can go to the bathroom, like it's okay, like you can go help yourself, you know, and they're like, oh, I forgot. It's like, how did you forget? We were standing here like this. Immune issues, they're probably getting sick a little bit more, you know, if they just like even just a small little cold here and there, their immune system's just kind of brought down just a little bit too much. Connection, this is a big one with you, for you autism mamas. You all experienced this before, just yearning for that deeper connection with your child. You know, the eye to eye, heart to heart, they feel you, you feel them, and it's just that great connection that you're looking for. Communication, many of them, like you say, we have some kiddos that can be nonverbal. However, then just like the communication might be not what you're looking for either. They were kind of have a bad back at you in a perfectly normal situation. You just went, no idea where that came from, but moving on. I should come hang out in you guys' daycare.
Yeah, at least one for every single thing.
And then cognition. This is when as they get into school and stuff. Their grades are slipping. You know, they don't get their homework done on time. They aren't, you know, producing and hitting those milestones as they should. Okay. Children are struggling to meet their full potential, but it doesn't really have to be this way. Okay. First major take-home point. So, like from all those things that we just went through, everything your child is showing you on the outside is exactly what they're experiencing on the inside. So these behavioral things that they're showing you, they have think about yourself whenever you might have a deadline at work, dinner has to be done, we have a recital, we have soccer practice, we have all this stuff, and then we just got hit with a big old, you know, project or something, and then you come home and everybody in the family just starts, Mom, Dad, blah, blah, blah. And then do you ever feel like that little chihuahua in the corner that just wants to be like, leave me alone? Right? Isn't that a good actually? But it is, we've all been there before. It's like, back, and who hasn't? I have 2 dogs. This is all I have, right? And I'm like, back on. So that's what those kids are showing us. They have no other way to show you than like this poor behavior or these poor emotions that then want to be disciplined at school. They want to be disciplined at daycare. It's not like they don't want to be bad. They don't want to have those. They really want to be a good kid. But they can't because they have and we're going to get into it, so much coming in that the output's just going to be like, I don't know what else to do. This is what I'm going to do to release this energy. Okay? So why? How many of you guys have asked yourself this? Why? Why? Okay? You probably asked yourself this, your spouse this, therapist, nutritionist, everybody. You're going, what is going on? And I'm here to say therapists are great, nutritionists are great, pediatricians are great, doctors are great, everybody's great. Everybody has their place in this stuff. That's the good news. But many of them probably haven't talked to you tonight, like we're going to talk to you about what the nervous system does and how it actually will help all those other things that you have been doing, okay? So here we go. We're going to have a fun little, you ready for this? It's pretty fun. So this just kind of shows, like you've tried, I want you to think about all those little different things that you've tried, and this is going to kind of show you a little bit of the missing link. Let's see, I'm a chiropractor and not a tech genius. Oh, I'm hitting the laser, that's why. Is it going? Oh, come on. Oh, there it goes, okay.
This is an awareness test. How many passes does the team in white make?
Sorry for you guys in the back. Go! So we're watching the ball here.
The answer is
13.
Good. Okay.
But did you see the moonwalking bear?
You saw it? She saw it.
I did not.
So we see all these guys passing the ball. We're passing. Oh, there he comes. Look at him. He's like, I know. So what that's saying, it's easy to miss something you're not looking for. Okay, so we've tried, like I kind of consider the people in the white shirts, those are the nutritionists, the therapists, stuff like that, which are all working. We're passing that ball around. We're trying to help these people out. But that moonwalking bear, that's your nervous system going like, y'all are missing out on the main guy right here, okay? So, getting into it, like I say, the nervous system, but even more importantly, the neurospinal system. So this is where kind of, as a chiropractor, I'm very passionate about this and how the spine starts to relate in. We'll be getting into that. So your nervous system, the central nervous system is a master controller of all of the body's systems, all of the functions, everything that you do day in and day out, your nervous system is controlling. Your heart doesn't have a separate brain. Your intestines don't have a separate brain. Your ovaries, testes, all don't have a separate brain. All comes from right up here, travels down the spinal cord, just like we see right here, and comes out into these spinal nerves. So that spinal cord is like the message highway from the brain to the body, and then we have all of these awesome nerves coming out of the spine, right through here, all the little spine, if you ever wonder, coming out in all these little nerves that you see coming out of these holes on the side, okay? So that's the nervous system right there. And it senses everything, and we'll be getting into that again here with like on the sensory processing. We're gonna be talking about that, obviously. But it just senses all the information and detects and sends that information back to the brain. So it sends stuff out to tell things what to do. Heart, beat, digest, lungs, breathe, digestive system tract, do your thing, everybody do your thing. Then also sends sensory information back up to the brain, okay? Our spine is the protector of it. How cool is that? How important then do you think our nervous system is? If it's primarily the only system encapsulated completely in bone, our skull, and our spinal and our spine, okay, completely encapsulates everything in it, other than the nerves that come out, and they're just like, hey, you got to do your best out there. And then what we talk about then as a chiropractor, then we have that beautiful nervous system, that beautiful spine. However, whenever issues start to arise, is something that we call in our awesome profession is a subluxation. Now, subluxation, vertebral, meaning in the spine, is a misalignment of the spinal column which negatively affects neurophysiological function. Nerve, physiological, how our body works, function, negatively affects that, okay? So we have a normal, lovely, well-aligned spine. This is an example of a subluxation. Do you see that? Kind of like a little kink in the system, okay? Yes?
Would torticollis impact?
Yes,
that?
big time. Yep, how old do you have?
He's 7 now, but he had torticollis when he was
When he was a baby.
Mhm.
Yes, indeed. So that, and like, did you try PT?
We did a lot of PT.
Did a lot of PT?
Because
Yep.
his head was basically.
Yep, and so PT's great, love it. What I normally do is like, we'll have somebody that comes in with torticollis, like, yeah, we came from the PT. Hey, that's great. But whenever we think about it, we could stretch this till the cows come home, eventually, and it probably worked fairly well. I'm sure you got some
It
great
did.
results.
Mhm.
What happens then a lot of times is kiddos that don't, we come and align this, that neck can then go, because the nerve that comes out and sends signals to that muscle that's spasming, then can relax and come back out. So a lot of times they'll come from a PT, I'll adjust that, and like adjusting a child's much different than adjusting an adult, by the way. I would adjust that little baby spine, just like checking the ripeness of a tomato, okay? We got it fixed. Please go back to your PT, because I don't know how to stretch that properly, okay? Yep, but absolutely torticollis can. Yep, good question. So within that nervous system then, this is what's kind of this is the big picture. We have two parts of it, okay? We've all experienced these two things. So we're gonna first talk about, let's talk about this guy. We're gonna talk about the sympathetic nervous system. Anybody ever heard of that? The sympathetic nervous system, probably a lot of you health professionals. It's our fight, flight, or freeze system. So if we're sitting here right now, and I know in Nebraska we get packs of bears rolling around, Lincoln, but if we were to have a big old grizzly bear come barreling in here, what are we all gonna do?
Scream.
Fight? We're either gonna fight. Whoever wants to fight a bear, I'll let you be up front. The rest of us are gonna be fleeing. But we're gonna fight, or otherwise we're gonna flight, or otherwise some of us are gonna freeze. Okay, that's just what our body does. Now, the natural, healthy way, though, is we need to come back to our parasympathetic side, which is what most of us are in right now. We're just resting. We're here. We don't have a single threat going on. We're digesting, we're growing, we're developing, and we're repairing. How many of our kiddos have issues with resting, healing, digesting, growing? Yes, all of those things. So whenever you think about dang, how much has my child been subluxated? We'll talk about when maybe that first one was. Is their body caught in this constant fight or flight freeze motion? And if it is, I think about it like tell patients, it's almost like having that back burner. You start out on simmer, and then you add another stress, and another stress, and another stress, and before you know it, you're like on 10 on your dial of the burner on your stove. That's what happens with these kids a lot. They get so much stress that their nervous system can't calm down, and it can't come back happily over here, okay? Another way I like to explain this, and a lot of people can get this, is we have a gas pedal and a brake pedal we all got here in a car today. So our gas pedal is going to be that same thing as that fight or flight response, or that sympathetic response. That means that gas pedal is down. Think about if you always just had your gas pedal down and you're going on I-80 out to Denver and you don't ever let go. You're either going to, one, run out of gas, or what? Engine's going to blow, okay? We need to be able to help these kiddos apply that brake system so then they are able to go, oh, okay, I can be right here and I can be good. But however, not only kids, gonna throw you all out there in my statistics of seeing patients, many of us have that fight or flight response even kicked on now. How many of us have ever had headaches, anxiety, woohoo, depression, acid reflux? Yes, huge, okay, that's a big one. Infertility, insomnia, poor sleep. Oh, what else do we have? Seizures, we have behavior issues, ADHD, sinus congestion, allergies. Yes, all of these things, Crohn's disease, sensory processing, fatigue.
I have a question.
Yes.
That wasn't me. I
Yeah.
have a question. Do hypothyroidism or Hashimoto's play a role in the
Yep,
nervous
autoimmune.
system?
Yep, so that's an autoimmune condition. So whenever we think about if our nervous system's cranked too high, it's more worried about protecting us, trying to keep us safe, and keeping things as good as, like, it's almost like herding cats. Okay, it doesn't have time for your immune system to function properly. Does that make sense? So if that nervous system's cranked too much, immune systems start to go out of, what's that? I know, as my hands are like white, like purple. Okay, can we see this up here? Yes, absolutely, autoimmune issues. Diabetes even, blood pressure, all that stuff too, okay? Very, very good question. How many of you have been told this? So kind of moving on from there, like you have your kids like, they're going, they're a feisty little one, they're rocking. But how many of you have said have been told it's normal and they'll just grow out of it? Yep. Well, let me tell you something. It's abnormal and they're just gonna grow into more things. So if we constantly keep that burner, we constantly keep that gas pedal on, how in the heck are they gonna grow out of it? The only way they're gonna grow out is if we apply that brake pedal. Then they actually have a chance to redirect their car and go a different direction. And maybe just push on the gas a little bit, not so hard, okay? This is a pretty interesting story to kind of go on top of that. This is little Jacob. His mom was told time and time and time again, this behavior is completely normal for his age. Bouncing off the walls, being sent to the principal's office all the time. No, like poor grades, not getting paperwork done, all this stuff. But obviously he's a cute little kid. But day after day, his mom was, going through this, and it was a constant struggle for their family. Came into the office, the scans that we do, which we'll talk about, his energy within his body was 4 times higher than the quote unquote normal scans that we would do on a kiddo that maybe doesn't have his issues that he's having. 4 times more. So think about us sitting here right now. If we had 4 times more the energy, yeah, we're not going to be focusing. We're not going to be able to do good in like our work or our whatever you guys do. You're just not going to have that focused concentration and do well at that. Okay, so we're here to show you clear answers. First of all, many of you are like, I don't have the right answers. Like, I don't feel like I've gotten the answers. Clear scans and a clear path to a true normal. That's kind of the foundation of a lot of these problems. Okay, so where's the disconnect? Enter chiropractic. Like I said, I've been talking more than neck pain and back pain. How many of you here tonight thought, we're going to chiropractor about these sensory processing issues? Like, what? Thanks. I like the skeptics in the back. They do deserve a beer back there.
Talked about it.
Like, why are we at a chiropractor?
Right, and
It's
most
just to
people
get us in there.
think that. Yep. What's that?
Is it just to get us in there?
Yeah, exactly. Get in here. But no, it's more importantly, Educate, educate, educate. So we talked about that subluxation after we went through like that, what the nervous system does, right? Remember that little kink in the hose? With subluxation, big fancy word we use here, don't even think about it anymore. What I want you to think about is stress is stuck on. Okay, that can be easy to remember. Sympathetic response, that gas pedal is stuck on with these subluxations. The longer it is there, the louder and heavier it's stuck on, and the more severe it becomes. It just doesn't go away willy-nilly one day. It just doesn't. I wish that it would. It just doesn't. So whenever we talk about that subluxation, the stress being stuck on, we're going to be talking tonight about stress, the types of it, okay? And we're going to be talking about the results of those stresses, okay? There's usually some big fancy words here, but I'm a farm girl from the middle of Nebraska, so I brought it down to just an easier form here, okay? So we're going to be going through all of this. But I want you to know, an accumulation and the inability to adapt to these three stresses causes what your children are facing now, okay? There's going to be some, like, she was born, with that, but there's still ways that we can help. So, physical stress, the first one, or trauma is the first T. The physical stress. This can even go back to if we really want to dive deep. Most of you obviously have the kids that they're here now, and like you're just not holding a little baby right now. But most of it actually goes back to how stressful was mama's pregnancy. Did they have issues with infertility? Did they have issues like with their delivery? All of those things factor into how much stress. Is mom an anxious person? Because that baby feeds immediately off of what mom has going on into that baby, okay? Does that make sense? So kind of in utero there. Birth strain, how many of you here had either like a difficult pregnancy or your labor delivery was like, okay, yeah. Any kind, and like also like intervention use like vacuum, forceps, C-section, and stuff like that. That can all factor in, okay?
What effect does a vacuum have on a kid?
So,
brain or birth?
Yes, very good question. Very, very good question. Well, and I have a lovely picture here later, but a vacuum, whenever you think about the little, like you take our neck and you make it the size of a baby's neck, okay? And you have a vacuum in there that then starts to stretch, suck, and pull.
It's just a reminder to relax.
Everybody, let's relax.
At 7 o'clock, I'm like,
let's relax for this lady and get ready for bed.
Relax and drink water.
Yeah. But yeah, so like that vacuum in there, or forceps, it's pulling and it's pulling on that neck, stretching and tensioning out that neck. And the little itty bitty vertebrae that they have right down in there and all the little muscles and stuff, it's not meant to take that much pressure or that much stretch or strain. Okay, I'll tell you this, so you're sitting here thinking, well, Jesus, the birthing process is hard enough the way it is.
Right.
Yes, it is. And so there's actually a statistic that we'll get to. 80% of babies actually come out of the birthing process with an upper cervical subluxation. Because whenever they are born naturally, and it's the most beautiful, and there's roses and angels singing and stuff like that, even though like that baby coming out, it's actually I think 60 pounds of pressure on their head and neck coming out. That's why I'm so passionate about getting to kids as soon as possible.
I asked because I have a grandson that's in the daycare, and he is so smart. Oh my God, he drives me nuts. You don't even show him nothing. He just watches you do stuff and then he's doing it. It drives you insane.
Yeah.
But the one thing he won't do is listen.
Listen.
Kid will not listen. And I was there, they sucked him out. I mean, he had a cone head, the whole nine.
Yep.
So I'm like, I wonder if that, they sucked out the listening.
The listening.
I wonder if that has anything to do with it.
The listening nerve gone. You should have that like.
He will not, the only way to get him to listen is the time you're gonna put him on the toilet. And then he'll sit down and pay
Typical man.
And he's 2, he just turned 2 in February.
Yep, so it's one of those, he has too much going, like he's like, I don't have time to look,
Yeah, but the other day he took a bib off of one of the babies, he's 2. He took the bib off, it was nasty.
Yeah.
I didn't tell him or anything, I just was watching him. Took the bib off the baby, went into the laundry room and put it in the washing machine.
I mean, he's gonna make a hell of a husband one day, is what I'm saying.
I called Liz. 'Cause
Is your
Liz
kid a boy or a girl over here?
Boy.
A boy, okay.
Yeah, I'm like,
My daughter also has
Who knows
ADHD,
that?
but
Okay.
clearly it's different.
Yeah, that's probably why. He has too much, he's too busy. He's very, very smart. Most of these kids are exceptionally and
Yeah.
incredibly intelligent. Very, very intelligent, because they're so smart on the senses that they pick up things very quickly, but then it gets into their brain, and they're like, "Ah, I got too much."
Well, that's why I tell Liz, I'm like, he can do everything you ask. He could probably build a house, I don't know, but he won't listen. Where's the disconnect?
I'd love to see if she was a girl, if it was a girl though.
No, it's a boy.
I know, but it would be cool, like if they actually Good, I mean, yes.
That's, I just
It would be
wondered.
interesting to see, like, you know, if I were to do something with him, like just to see an evaluation. Is he
Yeah,
gonna, you know, just to see.
he can put puzzles together, like I take the puzzles loose, and he can match up, like the ABC, he will match them up.
That's incredible. I mean, he'll use that talent one
He
day.
won't listen.
That's a man. Just kidding. More physical, this is one most people think of, childhood falls. I think they say a kid falls 5,000 times by the time they're 5. So each time that they fall on that bottom, boom, they're falling on that tailbone, boom, you know, each time they're falling on it. I see a lot of bedwetting because the nerves that come out of that tailbone actually go to the bladder and help control that bladder. So they fall on that tailbone however many times growing up, that's what's going on there. Cars, or even falling off the couch, down the stairs, car seats. How many of us have had a kid passed out, zonked out like that? There's a bunch of, you know, families, I know they're busy, and sometimes it's really easy, like, I'm just gonna leave them in the car seat, you know, because then they aren't moving, and like, we're just gonna keep them there, but actually that can kind of start to factor in with their spinal health. Car accidents, this is a big one. Most people think, oh, it's just a little fender bender, or a little this, or a little that. Kids are actually impacted more in car accidents than adults are, because they don't have that ligament strength or muscle strength near as much as adults do. Sports activities, as you can see, even like kiddos that are same-sided, like baseball or golf, gym, you know, just that constant one-sidedness repetition. Posture, this is a big one lately. The Chromebooks and iPads at school, like they're so small. So then like, not like, you know, I have her set a little bit higher, but these kids are like down like that,
Or
you know,
like
so
this.
yes, or like this constantly. They even have a diagnosis for the cervical spine now called text neck. It's a straight curve or reversed because it's so much like that. So whenever you just bring it up here, we're gonna be trendsetters from here on out. We're gonna be like that, okay? So physical stress, they must have went to Doc Luth's Continental Time. Yeah. I'm gonna look like a snooty person and send a text to her. Chemical stresses or toxins, we don't have to dive too much into this one. Processed foods, stuff like that. I'm not a nutritionist by any stretch of the imagination, but nutrition does factor in. But I will say a lot of us, many of us grew up in Nebraska, and like we're the GMO capital of the world. And we grew up on corn, or we grew up on gluten, but like we didn't get these conditions that we're talking about tonight, did we? No. We had a horrible diet. Like I look at my mom now, I'm like, that was terrible. She's like, oh, sorry. But looking at, you know, diet I feel like has gotten better for kids now because parents are more aware. You guys are so much more aware of better food, better nutrition. We just got to keep a monitor on that. The chemicals, they're everywhere. We do our best, but like I say, this stuff's always still been here. The big one I would say is if you have like teens or anything, like just keep caffeine, and like why are we putting a stimulant into a child that has a stimulant problem? Okay, just try to cut the caffeine. That'd be like, trust me, I have candy every day. Mental, emotional stress, thoughts. This is a big one, obviously, but this even goes back, like we mentioned, the pregnancy. There's such a stressful, fear-based pregnancy anymore. Like you find out you're pregnant, like and if you're 35 or older, you're like, oh God, like you might have it. It's like, don't put that fear and that stress into a woman right off the bat. Or like, don't tell like, oh, we're gonna do all this testing, you know, and you might have a child this, like, no, let's just let it be. Okay, so there's, like I say, even starts early on. NICU stays, any kiddos with NICU stays? Okay, both of yours. Fast-paced, high-stress life. Yeah, we're all feeling it. Getting labeled or diagnosed, even though I never diagnose or do anything with a child in here. I don't even tell people like, oh, you have this, or adults, you have this or you have that. All I say is, your nervous system's just not functioning as it should right there, and we're gonna help it get there. What is the last thing that any of us need to do? Whenever a person's told they have cancer, what's the first thing I go? I got I'm gonna die, like I got cancer, I have this. That is not what we need to do for these kids. We don't even need to go there. Bullying, big one. Technology, video games, social media. If you have those kiddos, just try to eliminate that just a little bit. Feeling of not fitting in, and then also this is a big one, like divorced parents. It's just tough. I don't think people quite realize the effect that it does have on those kiddos, no matter the age. It's just a stress. Things happen though, it happens. I'm divorced, it just happens. It's okay though. 6 early signs of those subluxations, symptoms of a subluxation that you can kind of think back now, even if you have like a teenager or a little toddler or whatever you might have. Fussiness or uncontrollable or uncomfortable as a baby, like can't be consoled. They are constantly fussy, arching their back, twisting. They might have had colic, they might have had ear infections, all of those things. You cannot make them comfortable. That's where we see a lot of babies in here, because like they just don't get comfortable. Well, coming out of that birthing process was pretty traumatic. Digestion issues, constipation, and being a picky eater. Who has picky eaters? Yeah, it's probably like the texture to them a lot, and they're like, oh God, no. Poor sleeping. That's a big one even for adults, signs of a subluxation. If you're not sleeping well, that's a big one. But these kiddos, they really need that sleep. I mean, I know I have a chart somewhere, the amount of hours kids need to sleep at different stages, it's huge. And if they're not gonna rest, digest, heal, grow, develop like we talked about, okay? Because they're stuck in that fight or flight mode. Weak immune system, they're getting sick a lot, poor posture, and then obviously down here for what we're here for tonight, okay? So the result, we talked about all of the stress there, okay? Stress. How does that subluxation get there? What is that subluxation even doing? Here we go. So here's these big fancy words. Dyskinesia, disafferentation, dysautonomia, dyskinesis. Who cares? Like, let's get back to what it actually means. So don't even, I just want to show you that I knew what it's called. But moving on here, this is a quick synopsis, but we're gonna dive a little deep into each of them, not too much. But whenever you have poor motion within the spine that houses that spinal cord, think about that as a garden hose, okay? You're trying to water your garden, but there's a kink in it, okay? That kink is the subluxation in your spine or in your body, in your nervous system, that then is going to send poor signals to the brain. The brain's getting signals, but they're scattered signals. It's like playing that game telephone. By the time it gets we start here and we say something with kids, you're gonna hear something completely different than what I said. Same thing, you're the brain, I'm the nervous system out here saying, these are the senses, that we're gonna be talking about. I gotta get that information to that brain, but by the time it gets there, it's gonna be like, what? Like I said, I'm from Kentucky. She's like, she has a cat in Columbus? What? No. So we have poor signals and communication going up to the brain. Whenever it gets to the brain, we have an imbalance in that nervous system. It's going, you just sent me these signals. It's like getting 30 emails at work that might be half done. What? You want me to do? I have no idea. What are you going to send out? You're going to send out errors in energy output and organization. That's poor behavior. That's poor digestion. That's poor immune system. All of that, okay? So you try to water your garden with a kink in the hose, it's not going to happen. You try to get proper signals up to your brain with the subluxation in your spine that's supposed to be sending signals to your brain, it's not going to happen. Make sense? Okay, with me? Here's what genius is. You can all go to chiropractic school and pass. So that subluxation, just to dive a little bit deeper, lack of movement, it's restricted. It's locked, restricted, fixated. How many of you even sit here tonight and you're like, oh my God, my mid back, if someone could just take a hammer to it, I'd feel so much better. That's a subluxation. Locked, restricted, fixated. Tightness in that neck. Headaches. Locked, restricted, fixated. And I talked on an earlier slide, the longer that it's there, the more severe it comes and the harder it is to get that ship turned around, okay? Especially within the spine, we've talked about that. 60% of dysfunction, so like function within your body, can actually be in effect before symptoms even show. Pain is the last thing to show with a lot of people, okay? Symptoms within these kids, they've had actually probably like many people, they might not get diagnosed till later on, but they're starting, like you might, was it something? Was it not something? Most of the time it's already in effect before we actually get it. And we're already in the storm going, what do we try? What do we do? What are we doing? And it's already there, okay? Once again, subluxation, stress stuck on. If nothing's done in a timely manner, it just keeps getting, like you say, I think they'll grow out of it. No, they won't. It's just gonna continue to get worse. Where does it first begin? Okay, so whenever you see this, see how we can change that real quick. But whenever that baby is either being birthed or pulled out, many times they don't, and I could go on a tangent of why we have women giving birth on their back as they have to come up the hill of the sacrum, but anyway, whatever. They're having to be pulled out from there, and sometimes they're having to be twisted. Many doctors are hand dominant, so you're actually gonna have like a right-handed doctor going in there and they give it a twist and pull. You'd be shocked at how many people come in, little babies come in and the right side is what's out because of that hand dominance of the doctor. So you have these birth traumas that come in. This is when that first, like right here, 1,000 infants were checked, 80% were found to have that upper cervical vertebral subluxation. So whenever you think about your kids and you have a one that started like with the autism at 2, yeah, it's like those things were already there. They're already starting to make that fire, okay? It was already going.
Yeah, one thing with my son, we actually did chiropractic care for a while because I noticed when I was nursing him,
Good.
when we were on one side,
Yep,
he
you didn't
was
wanna go to the other side.
so uncomfortable and
Uh-huh.
didn't have that range
Good.
of motion.
Perfect,
So,
perfect, love it. But like this was back in 1987. This isn't new information. That was 34 years ago, 35 years ago, 33. So this isn't all new. There's actually another one that's from 1966. But anyway, moving on. So we have those, the kink. We have the kink in the hose, the kink in the nervous system, poor signals communication. So we have those 5 senses. We're here for sensory processing with a lot of these kids, right? So their senses are getting up to the brain in a way, many of them are very heightened. How many of your kids like don't like loud noises? Don't like loud, like bright lights. They hate the tags on their shirt. Love soft things, okay? That's their nervous system being overactive, overstimulated, sending those signals to the brain that like quote unquote normal, most of us think, oh, it's just like a tag, it's fine. For those kids, it's like that one boy, 4 times. Some people it's even more. It's like, get it off of me, okay? When I went through my anxiety I couldn't even go, like I was the crazy person in Target wearing sunglasses because like the lights were too bright for me, okay? Like I was having sensory processing issues as an adult. TV too loud, my parents are old, turn it down. There I was, I could not handle it myself. So input controls output. If this is too much and too heightened, their output's gonna be too much and too heightened, okay? We have a 6th sense here. It's a big fancy word called proprioception. Has anybody heard that? Okay, it kind of lets our body know where we are in space. If we shut our eyes, we know where it's at. We know that my right arm is out here off to the side, okay? It's just what our body knows. 60% of that proprioception is found within our spine, okay? So if there's if there's structures within there not functioning as they should, that proprioception is gonna be off. What proprioception does is charges the brain's batteries. Okay, so if it's not getting the best information, the battery in the brain is not getting charged fully, okay? Like I said, 60% in the spine, 1/3 of that is in the upper neck, okay? It's like the little one with the breath, yeah, not liking it. We get that imbalance up there in the brain. We're getting the poor signals, imbalance up there in the brain. Constantly then getting stuck in that fight or flight mode, okay? Gas pedal is constantly on. Sometimes it's revving up so dang high. This is why we're having these issues with those kids. Controls everything in the system, okay? We got immune, digestive, endocrine, circulatory, respiratory, muscular. All those things will just want to shut down because the system is just cranked up way too dang much. Going back to this is kind of a fun way that a lot of people like to look at this. Many of these kids have Ferrari engines with bicycle brakes. And then we're not slowing down. We are not going to make this turn right now, okay? That's what they're experiencing. Then output. Why most of us are here tonight, we don't care for the output that we're getting from our child, whether it be behavior, not sleeping, doing poorly in school, not having that good, communication with our parents, not having that good connection. That output is why that is there, because we have such mixed signals getting to the brain not knowing what to do with it, and it's just sending out information that it wants to send out. It doesn't know why, it's just sending it out. We're getting rid of this energy right here. So whenever we have errors in that, we're gonna have that behavioral changes. And another way to look at it, when reception is terrible, what do we do when we're on the phone? I can't hear you. No, we get louder, like I can't hear you. Then we eventually get frustrated and we hang up. Okay? So going back to that subluxation, like changing that neurophysiology within the brain, everything. Does this start to make a little bit of sense to everybody? Okay? How do I know if my child's nervous system is subluxated or whatever? I'm not going to sit here and fill you full of smoke. We actually have scans in this office that detect, one, where those subluxations are within that child's spine. If you think about it this way, it's a dual thermometer is what it is we take it up their spine, okay? Whenever we roll our ankle, what does it do? It produces swelling and then it produces heat, correct? So we want to ice it. Same thing within your spine. Your ankle joint, just all those joints in the ankle, each one of these two vertebrae coming in is a joint as well. If we roll our ankle or get a physical trauma or stress within our body, it's going to cause these guys to almost kind of roll like the ankle rolls, okay? It's going to produce, whenever it's irritated, swelling, and therefore produce heat. This scan that we do goes all the way up their body. It shows us exactly where the areas are that are impacted and lets us know how severe they are. That's one of them. And then another one lets us know the amount of energy that's battery's low, we're almost done here. Would you grab my charger out of there just in case? That would be helpful. But then the other scan shows us how much energy, like too much energy is within this child. Like whenever they talked about that boy having 4 times the energy, we check those paraspinal muscles along his spine. Those are going to be a little bit hypertonic, a little bit too tight. That lets us know how much energy is within his body, because if you think about the muscles along the spine, that proprioception that like sends information to the brain, if it's so tight, that's what their body's feeling, okay? And that's where we're able to detect how much energy is actually in there, and we need to bring it down. So then like you're able to actually look at it, you're able to then like, okay, we're going through something, like we're going through a treatment or a care plan or whatever, we can show it's going down. We're on the right way, or if it's not, we're gonna go over here, but it at least then shows parents, it shows caretakers that we're actually making improvement in their child and not just blowing smoke up your derriere, okay? So that's what those scans show. Kind of looking at them here, this is when he first came in, we couldn't even get his entire body. He was like, I am not having you right now, lady, because he was just starting out. He was doing this, he was doing that, but by the time we get through, we were able to get a full scan on this boy. And what you see here, bunch of red isn't good. It starts to balance out here with white, blues, greens. So we have a little bit of a red, white up here still, but at least we're able to get the full thing and be able to help this young boy, okay? So action steps to take, I always like to leave people with things that you can like immediately go and start to do now. Decrease those 3 T's, and I think that's probably on some of those. Just watch, like what kind of emotional stress your kids are going through, physical stress they're going through, chemical stress that they're going through. Kick that caffeine out, start to implement some good stuff in there, fruits, veggies, trying to get that sugar down. Increase their ability to adapt. That's what we do here. So we increase their ability to adapt to those 3 stresses, taking stress and pressure off of their nervous system. Good signals, proper signals getting up to the brain balancing out between that sympathetic, parasympathetic, and going, hey, I know what you're saying. And it now literally be me going back there and telling her exactly what I want her to know, versus it getting mixed signals. Then the output comes out in better, better behavior, better grades, better family cohesiveness, a lovey little kid versus, the spastic one that we don't, we still love and adore, but like, God, can you just settle down for a second? And then just find out how we can help you. Whether this is a path for you, whether it is something else, I have connections, and I'm so happy to have some more ladies here that have, the therapies and the counseling. Just reach out, just have somebody else be another source for you, because I think so many parents, so many families don't know where to turn to, they're confused, they're lost. It's okay to just have another means of communication. If it's not one thing, we help you find another thing, okay? It's just helping you guys, because a happy kid equals a happy family, and then we're able to do the things that we love and enjoy, okay? On this last testimonial, this one's pretty impactful. This is Jake. He came in. This might have been one of the worst cases that we had. Lots and lots of stuff going on. During the course of Jake's chiropractic care, we're happy to report several improvements in our son's behavior, communication, sociability, frequency of falls, and sleep patterns. So you can see all the things that they're looking for to get help with their child. By the 6th visit, this is how adaptable kids are. They're incredible. They're way better than adults. We noticed his vocabulary had increased significantly. He is not only speaking, but putting sentences together more frequently, and he's interacting well with others and showing compassion. Then it happened is right after his 24th visit. Yeah, you see 24 there, but they're gonna, like, I know what it takes to get them there. I'm never gonna shortcut anybody's care, because I've done that before, and the parents and the kids didn't get the results that they want. So whenever I make a plan and I make something for a kid, I'm getting them the dang results that they need, okay? We got home after that 24th visit. He crawled up on my lap, hugged me for what seemed to be the first time in forever, and said, "I love you, Mama." Okay, so that right there is why I do what I do. I love neck pain, back pain, headaches, but this is so much more impactful, you know, for me, and helping people the way they function, helping the way kids function is so much more. Back pain and neck pain, we can take care of that easy, but let's actually get you functioning better too, and your kiddos. So, thank you for your attention. You guys are a fun group. Like, this was a lot of fun. This is, like I say, why I do what I do. Offering out to you guys, I know what it's like to be stressed. I know what it's like to be, I don't have a kid like I say with that, but I've been there before as myself as an adult. Okay, I understand the doubt. I understand the frustration. I understand the hurt. So just having somebody there with you to guide you along. Please ask any questions if you do. We're gonna be taking questions. Now, if you have something that's more major, you know, and you don't wanna shout out in front of everybody, please come up and grab me. We'll have a quick conversation. But with that, going forward on that, tonight I would love to offer out to you guys like the scans there. Okay, normally for a first visit for our families, or for an individual, is $285. We're offering that at $75 tonight. Okay, you can see where your child is at. You can see how their system is functioning. You can get a good baseline of where they're at. Take them to another level. But this is just what I wanted to provide to you guys tonight, is just a missing link of what maybe you've been searching for and going, why hasn't anything else fully worked? Okay, behavior therapy is going to work once their nervous system's better. It's going to work better once their nervous system's in tune. The nutrition that you're doing is going to work better once their nervous system's correct. Okay, does that make sense? All that, everything's just, you can keep doing those things, but once their nervous system and that baseline is actually where it should be, everything else should work perfectly. Okay, thank you. Do we have any questions?